I'm the chair of the college. On behalf of the College of Pharmacists of BC, I would like to acknowledge and thank the Coast Salish people on whose unceded traditional territories I'm chairing the college's 129th AGM from, the ancestral lands of the Musqueam, Squamish, and Tsleil-Waututh First Nations. As we're meeting virtually with attendees from across BC, I would also like to acknowledge that the Indigenous peoples are the traditional stewards of the lands and waters from where each of us is attending the meeting this evening. I encourage all of you to learn about the unceded traditional territories and the Indigenous peoples where you live and work. I'm honored to welcome Elder Sequoia from the Squamish Nation to our AGM to start out this meeting in a good way. Sequoia is a knowledge keeper and elder with strong Indigenous worldviews, ancestral knowledge, and traditional teachings, who is widely respected and acknowledged for her work and energy and commitment to her community. And I'm grateful to listen and learn from you tonight.
Kayachtan, I welcome each and every one of you to this 129th gathering of your college. It's really made me want to do the math to when the first one happened. So quite an accomplishment. And I welcome you to our unceded Coast Salish territories of Squamish Nation, Tsleil-Waututh, and Musqueam for those in the Lower Mainland. And on behalf of all the nations within BC, wherever anyone's zooming in from, I welcome you to their unceded territories, although I usually don't do that. I'm Sequoia and Wanik, and my ancestor I'm named after her lived in the island now known as Stanley Park and at Lumber.
Sequoia, I think you've been muted. I'm not sure what happened. There we go.
There. And my great-grandfather was Chenaltzit, who the priest named Jericho Charlie. His home was at Iamo, and that's now known as, they thought to name it after him, and it's known as Jericho Beach. And my grandson, who lives with me with my adult daughter, carries that name. So there's still a Chenaltzit living. And so I welcome you. And I ask you all to come together with Nchomo and Squalwin in Squamish language, and Hamalkamalum, it's Natsamat and Squalwin. One heart and one mind as you come together tonight to share words and be able to come together and listen to the words and share all your different views when you have to create good solutions for the present and future generations. And I just want to say that my grandfather shared with me that we all pray to a higher power. The higher power is known by many names. And he said, always respect everyone's ways. So I'm going to ask you all right now to respect that. I'm going to ask you to come together and open yourselves to the energy of the Creator and ancestors and each other. Even though we're virtually gathering, you can share that energy and send it to each other. I sincerely believe that, like my elders did. And so when I'm going to share a part of Sequalia's song, Ha Squal, Sequalia's song, greeting of the day, and then do a prayer to open you for your gathering. And I'm going to ask you, tease you now and say, as I always do, the old people say, don't be like this, don't be like this or this, because you're blocking off your energy that's within you to the energy from Creator and the ancestors and each other. So I usually tease everyone when I'm in person and say, now we're going to do our Tai Chi and yoga exercise of breathing. And just ask you to open yourselves up in your hands and take a few breaths. to feel the energy from Creator, ancestors, and each other. I'm going to sing the song, Sequoia song. While I sing, I ask you all to please pray for all of your family and friends. And then I'm going to do the prayer, and then I'll turn you back over to your host, and I'll be saying farewell. And I hope to see you again. Hoichaha. Chen Quen Mentomi Kakakanik Chasiam Yonzionzo Tunoyop and Manman to squalls to seats. Yonzio Manman Squalwan. Yonzio Manman Equadal Chet Squalwan. Yonzio Manman Sayayai Chet Squalwan. Asking you, Creator, to watch over and protect and guide each and every one of your children gathered here tonight, and also their family and friends, and help all of them with their squallowing, their feelings in their hearts and minds, their mental, emotional, physical, spiritual well-being. Asking you, Creator, to help tonight's gathering be a Yetwan Haltse Top excellent work tonight, and asking you, Creator, to let people hear the words that are spoken, the snachum, and to take into their hearts and minds what they need tonight, and let what they don't need be set aside to maybe bring back another day when they need it, and to be respectful and share all their different views to create positive solutions for the present and future generations. Asking you, Creator, to also hear our prayers for all our family and friends during these times who have serious illnesses and injuries, for prayers for their health, healing, and recovery. Asking you, Creator, to also hear our prayers for all our family and friends who may have traumas and are battling alcohol and drugs, especially all the people right now because of the opioid crisis that's taking a lot of young people because of the fentanyl and the supply, and those incarcerated who may be getting out and are incarcerated because of their traumas and battles. Prayers for them, for their health and recovery to get on a wellness path. Also, Creator, prayers for all their families who always have constant worry and stress for their loved ones and don't want to lose them. Let our prayers lift them up and help them feel a bit ease this evening. Asking you, Creator, to hear our prayers for all our family and friends who may have lost loved ones, who are heavy in heart and over the loss, to know their family worries about them and sends signs. They say dragonflies have two sets of wings because they carry angels on their back, and that ladybugs and butterflies are angels coming to visit if you see them, and suddenly. Or maybe you see something when you're in a low mood and you're walking or look out and there's an eagle or a raven or something that you don't normally see that lightens your heart and makes you smile. That's a loved one spiritually helping lift your spirit. So always watch for the signs and know that they are protecting us with Creator. Asking again, Creator, that tonight's work go well and to watch over everyone as we leave tonight and go forward. Tuma Kwitsi Snachum, those are my words. I say Chen Quin Mentomi. I'm grateful and thankful to each and every one of you for allowing me to share a bit of your time this evening and share a bit of my words. And I say, Wachayap yo, you all take care.
Thank you, Suqualia, for sharing this with us today. And on behalf of the board, I'd really sincerely like to thank you for your continued hope for healthcare and the effort that you put into helping create a healthcare system that can provide thoughtful care for First Nations people, and for your welcoming words and leading us in a prayer today. So thank you very much.
Hoichacha. Chenqua Mentomi and Hoyt Mathloth. I'll see you all soon.
Thank you. Our college is committed to improving BC pharmacy professionals' work with Indigenous people, and we recognize there's still much to do. We all need to reflect on your words, and I know we will. Thank you. I'm now pleased to introduce the college's board members in attendance tonight. Myself, Christine Antler, District 2, Fraser Valley, and the chair. Anka Kvach, District 6, Urban Hospitals, and the board vice chair. Alex Dar Santos, District 1, Metropolitan Vancouver. Andrea Silver, District 3, Vancouver Island Coastal. Stephen Hopp, District 4, Kootenay Okanagan. Michael Orchinsky, District 5, Northern BC. Claire Ishoy, District 7, Community Hospitals. Val Dillon, District 8, Pharmacy Technicians. Tracy Hagel, Government Appointee. Katie Skelton, Government Appointee. And Ann Peterson, Government Appointee. Justin Singh Thind, another government appointee, could not be with us this evening. I'm also pleased to introduce College Registrar and CEO, Bob Nakagawa. And I know that we also have many college staff joining in online tonight, so welcome. With 48 registrants present, our quorum requirement has been met. In addition, the college met the 3-week notice requirement. Therefore, this meeting is duly convened. We need a quorum to be present for the duration of the meeting, so please stay until the meeting is adjourned. The agenda for this evening's meeting is available on our website and was shared as part of the AGM registration process. As required as part of our AGM, we will next address the minutes of the previous AGM, as well as the financial statements and auditor's report. Following this, both myself and Registrar Bob Nakagawa will present reports on activities of the college from the past fiscal year. So the next item of business is the approval of the minutes of last year's annual general meeting. The minutes were included as part of the materials provided when registering for this AGM and are also available on our website. I'll ask now if there are any errors or omissions in these minutes, and if so, please use the Q&A function at the bottom of the screen. Seeing no comments, these minutes are approved. The next item of business is the college's financial statements. The audited financial statements are available online as part of the college's 2019-2020 annual report, available at annualreport.bcpharmacists.org. Are there any comments or questions about them? Again, please use the Q&A option if you have any. Just give it a minute. Seeing no questions, I'll I'll move on. The report will be placed on file. The audited financial statement has already been reviewed and approved by the board, so no vote is required at this meeting. And now we'll move on to the chair's report. And I'd like to start by thanking my fellow board members as well as the college staff for their hard work that allows us to fulfill our mandate in protecting the public through the regulation of pharmacy practice. I'm proud of everything the college has accomplished this past fiscal year, which ran from March of 2019 through February of 2020. From continuing to help combat the opioid crisis to medication error reporting, modernizing the college's PODSA bylaws, and work towards improving cultural safety and humility, the college has been hard at work striving for better health and pharmacy care in British Columbia. While not a part of the past fiscal year, I'd also like to acknowledge the work done by my fellow board members and college staff in responding to the COVID-19 pandemic. I also recognize that this time has been immensely challenging for all healthcare workers, including pharmacists and pharmacy technicians. While our role as regulator is to ensure that all pharmacy professionals are practicing safely, I'd like to thank all the registrants joining us here today for their tireless work in continuing to ensure British Columbians can safely access the pharmacy care they need. As the situation regarding COVID-19 continues to evolve here in BC, Canada, and other jurisdictions in the world, the college will continue to work closely with the Ministry of Health and other partners to support the response to the pandemic as part of BC's health system. The college recognizes that cultural safety and humility for Indigenous peoples in BC is vital for the provision of fair and equitable health services, as well as the creation of a healthcare environment free of racism and discrimination where individuals feel safe and respected. Cultural safety is an outcome based on respectful engagement that recognizes and strives to address power imbalances inherent in the healthcare system. And cultural humility is a process of self-reflection to understand personal and systemic conditioned biases and to develop and maintain respectful processes and relationships based on mutual trust. Cultural humility involves humbly acknowledging oneself as a lifelong learner when it comes to understanding another's experience. I'm pleased that we continue to take action on the formal commitment we made to cultural safety and humility alongside BC's other health regulators. We have made some important first steps. However, there is still much work to do to achieving our collective BC health system's goal of culturally safe health services for Indigenous peoples in BC. I encourage you to read the cultural humility and safety reflections in our annual report to learn about our progress last year and to reflect on how to apply these learnings to your practice. The opioid crisis continues to be a top priority for us and other public health organizations across the province. And now we are facing dual public health emergencies with both the opioid overdose crisis and the COVID-19 pandemic. COVID-19 has had a significant impact on the opioid overdose crisis. The BC Coroner's Service has detected a sustained increase of illicit drug toxicity deaths, recording 6 consecutive months with over 100 overdose deaths, 3 of which saw more than 170 deaths. Much like in recent years, last year the college continued to work hard to help combat this issue, such as implementing new policies and training requirements and collaborating with other healthcare partners where needed to support evidence-based guidance to improve care. And of course, this year, in response to the dual health emergency, we implemented additional amendments intended to help registrants care for patients with substance use disorder while in the midst of a pandemic. Registrar Nakagawa will also speak more in depth about the various measures taken by the college over the past year in responding to this opioid overdose crisis. In September 2019, the board approved a motion requiring mandatory anonymous medication incident reporting in all pharmacies. The issue was first presented to the board at its November 2017 meeting by Melissa Sheldrick, a patient safety advocate whose son passed away due to a drug dispensing error in Ontario. Medication errors are a leading cause of preventable injuries and result in significant costs to health systems across the world. Between 2017 and 2019, the most common complaints received by the college were related to medication dispensing errors by pharmacy professionals. Ultimately, The goal is to allow non-hospital pharmacies to use any medication incident reporting platform they choose, provided it is among those that meets the college's criteria, which is to be developed, including the capability to transfer a minimal data set into a national repository that is administered by an independent third party. As part of exploring the best path forward for medication incident reporting in BC, the college has been participating in national conversations on the implementation of medication incident reporting systems, including the NAPRA Medication Incident Reporting Working Group. Moving forward, the college will continue to work with the NAPRA Working Group to develop medication incident reporting standards and criteria and establish a single national repository. Mandatory anonymous error reporting provides data that can be analyzed to help identify trends in errors that are occurring and provide opportunities to learn from mistakes, improve practice, and better protect the public. Over the next several years, the college will be developing standards and criteria, as well as bylaw and policy changes to enable implementation of a mandatory anonymous medication incident reporting program by 2022-2023. The implementation of mandatory medication error reporting aligns with the college's duty to protect the public, as well as its vision of better health through excellence in pharmacy and code of ethics. On November 27th, 2019, the Honorable Adrian Dix, Minister of Health, announced proposed changes to the regulation of BC's health professions, with a focus on increasing transparency and patient safety. The proposed changes came in response to a December 2018 report by Harry Caton, reviewing the Health Professions Act and providing recommendations to modernize the regulatory system in BC. The proposed changes, developed by the newly established Steering Committee on Modernization of Health Professional Regulation, were presented in a consultation paper entitled Modernizing the Provincial Health Professional Regulatory Framework, a paper for consultation. Members of the public, community groups, and health sector stakeholders were invited to submit feedback on the proposals in the consultation paper. And the college board met in late 2019 to discuss the consultation paper and provide a response from the College of Pharmacists. Much like the recommendations made by Harry Caton in his report, many of the proposals in the consultation paper resonated with us and reinforced practices already underway at the college. Recently, in August, the final recommendations for changes to the province's health profession regulatory system were released by the multi-party steering committee. The modernization recommendations include commitment to cultural safety and humility, improved governance, including competency-based board appointments and balanced board membership, improved efficiency and effectiveness through a reduction in the number of regulatory colleges, with a reduction from 20 to 6. And the College of Pharmacists of BC will be one of these 6. Strengthening the oversight of regulatory colleges, including creation of an oversight body, changes to complaints and adjudication with increased transparency and a new independent discipline process, and information sharing to improve patient safety and public trust. We commend the steering committee for their foresight and leadership and for their work to reform health profession regulation in the public interest. On January 2016, 2020, amendments to modernize the college's bylaws under POTSA came into effect. The board approved these amendments at its November 2019 meeting as part of the legislative standards and modernization goal within the college's 2017-2018 to 2019-2020 strategic plan. As a result, the updated requirements are now principle-based, allowing greater flexibility in how pharmacy services are provided while ensuring they still achieve their intended public safety outcome. In particular, these amendments addressed operation of a community pharmacy without a full pharmacist, responsibilities of managers, direct owners, directors, officers, and shareholders, storage of drugs and confidential health information, including off-site storage, provisions to allow for community telepharmacy reinstatement, bylaws that are not being complied with based on data from the practice review program, PharmaNet requirements in light of the transition of administration of PharmaNet functions to the Ministry of Health, and housekeeping amendments to ensure consistency of writing style. These changes reflect our work in updating our requirements to follow best practices for regulation, such as the concept of right touch regulation. Right touch regulation means always asking what risk we are trying to regulate, being proportionate and targeted in regulating that risk, or finding ways other than regulation to promote good practice and high quality healthcare. To that end, I'm also pleased to announce that on September 25th, 2019, the college joined a number of other BC health regulators in the formation of the BC Public Advisory Network, also known as BC PAN. BC PAN brings a public voice and perspective to multiple health regulators in the province. The goal of BC PAN is to encourage more comprehensive and meaningful public engagement on important issues related to healthcare regulation in BC. There are currently 11 public members involved with BC PAN who provide their feedback on a variety of topics to help guide professional standards, policies, and communications directed at the public. In February 2019, the College Board approved a new patient relations program standard to be included under the Code of Ethics in the Health Professions Act bylaws. The standard helps to protect public safety by providing clearer standards and requirements for dealing with misconduct of a sexual nature, as well as raising pharmacy professionals' awareness of their responsibility to educate themselves on professional ethics. The standard provides a more robust regulatory framework to protect the public against a range of patient relations issues. It also provides guidance to pharmacy professionals on maintaining proper professional boundaries with patients and former patients, and preventing professional misconduct of a sexual nature. This guidance aligns with the principles of the framework for a model patient-practitioner relationship program for BC health regulators, applying them to pharmacy practice and enhancing regulatory safeguards to protect patients and the public. In order to enhance transparency, as of September 1st, 2019, the college began to publish citations and discipline hearing notifications as individual items on the homepage and news section of its website, as well as in its monthly ReadLinks Roundup email, which is sent to all pharmacists and pharmacy technicians. Previously, citations for discipline committee hearings were published under discipline hearing notifications on the college's website 2 to 4 weeks prior to a scheduled hearing. Greater accessibility to this information improves transparency and assures the public that they can trust their pharmacies, pharmacists, and pharmacy technicians to provide safe and effective pharmacy care. And now I would like to introduce the college's registrar, Bob Nakagawa, who will speak in greater detail about some of the key projects and initiatives undertaken by the college over the past fiscal year.
Thank you, Chair Antler. Before I begin, I'd like to acknowledge that I'm joining today from the unceded Aboriginal territories of the Coast Salish peoples, and in particular, the Coquitlam First Nation. Coquitlam refers to the unique sockeye salmon that once ran abundant in the Coquitlam River and Coquitlam Lake, which is just next to my home. And those salmon sustained the community for thousands of years. It's been an honor to serve as the college's registrar for the past fiscal year, which ran from March 2019 to February of 2020. College staff continued to work hard to ensure we are fulfilling our important mandate in protecting the public, both through our ongoing operations as well as through programs on strategic initiatives. I'd also like to recognize Chair Antler for her efforts as board chair over the past year. It's been an incredible year. And Christine, you've done a phenomenal job of chairing the board and leading the college in these unprecedented and hopefully times that we will never see again. But you did a fabulous job, and I'm so pleased that I was able to work together with you. I'm going to start out with the registration numbers. I'm pleased to report that increases in registration numbers occurred across the board this past year. And in 2019 to 20 fiscal year, we had 6,354 full pharmacists, 869 student pharmacists, 1,654 pharmacy technicians, 1,370 licensed community pharmacies, and 73 hospital pharmacies. In March of 2017, I had the honor of joining the rest of the province's health regulators in signing the Declaration of Cultural Safety and Humility in Health Services Delivery for First Nations and Aboriginal peoples in BC. Through this, the college pledged its commitment to make our health system more culturally safe for First Nations and Aboriginal peoples. Since then, the college has worked on developing a strategy to fulfill its pledge to improve BC pharmacy professionals' work with First Nations and Aboriginal peoples over the last fiscal year. Moving forward, we recognize that working together with the First Nations Health Authority, other health regulators, First Nations groups, and others will be essential to act on our plan and to create a healthcare environment free of racism and discrimination where individuals feel safe and respected. In May of 2019, the college was fortunate to be invited back to the second annual Mental Health and Wellness Summit, hosted by the First Nations Health Authority. The college used this opportunity to build trust with members of First Nations communities and help address the fact that Indigenous peoples are too often exposed to systemic stigma and racism, and that this can sometimes occur, unfortunately, in healthcare settings. We did this by sharing resources and building awareness of our complaints process and how patients can report concerns with the healthcare they have received. First Nations in BC have also been disproportionately affected by the opioid crisis. So as an exhibitor, the college used this opportunity to spread awareness of emergency use naloxone, including intranasal naloxone, and its importance in helping prevent opioid overdose deaths. In January of 2020, college staff, as part of the BC Health Regulators Cultural Safety Task Force, took part in FNHA's 10th annual Gathering Wisdom Forum. The forum provides an opportunity for First Nations governance, health and wellness leaders to dialogue with FNHA on health programs and services and discuss the role of health and healing in nation rebuilding. As an exhibitor, we use this opportunity to focus on two key objectives related to public protection. First, to raise awareness and build trust among members of the public and First Nations communities about health profession regulation in BC, including where to go with complaints about potentially unsafe and/or disrespectful healthcare services. Second, to dialogue with members of the public and First Nations communities about cultural safety, collecting stories and feedback regarding topics that center on culturally safe healthcare services. The BCHR Cultural Safety Task Force released a report on the learnings from this dialogue. I encourage you all to review the Gathering Wisdom Forum Read Links article that we shared last month, which shared many of the learnings from this event. I also need to acknowledge that allegations and ongoing investigation into the incidents of Indigenous-specific racism within BC emergency rooms. Such unethical and racist behavior has no place in our society or our healthcare system, and places extra urgency on us as health regulators to continue to push for a culturally safe healthcare environment for Indigenous peoples. This disgraceful behavior towards individuals who are seeking help within our healthcare system undermines trust in all healthcare professionals, and we will not tolerate amongst our registrants or within our healthcare system. We continue to extend our full support to Ms. Turpin-Lafon's investigation of these allegations. We will be reviewing the results and recommendations of the investigation to help inform where the college can take further action to eradicate racism from our health system. As Chair Antler mentioned, I encourage you to learn more about how to improve cultural safety and humility and reflect on how you can apply it in your practice. In addition to the work continuing to improve cultural safety and humility for Indigenous peoples, we also recognize that much work still needs to be done to address other forms of racism and discrimination in both our healthcare environments and society as a whole. The events of this year have caused me to reflect on the college's role as a regulator in supporting Black people in British Columbia, which in turn has caused me to realize how much more we still have to do and learn in order to meaningfully address this issue and affect real change within the healthcare system in our society. Moving forward, we need to consider how intersectionality, where multiple concurrent and outgoing types of bias influence and amplify one another, and how that impacts on patient care. It's a common and unfortunate misconception that BC and Canada are somehow exempt from the racism, discrimination, and stigma faced by our neighbors to the south. This misconception, I believe, is at the core of what we need to change as stewards of public health and safety. We can and must do more. Earlier this year, I pledged the college's commitment to developing a plan to guide our organization towards raising awareness of and combating the racism faced by Black people in BC. In order to do this, I've established a working group within the college to help lead this change and identify ways that we, as both an organization and a regulator, can take action and reinforce the fact that Black Lives Matter, and that racism in any form has no place within our healthcare system. 2S LGBTQ+. As we consider how biases such as racism and sexism can influence and amplify one another, we also need to consider the unique challenges that 2S LGBTQ+ community faced in the healthcare system. At the November 2019 board meeting, Bex Peterson, a non-binary writer, student, and advocate for 2S LGBTQ+, presented to the board guidance and guidance and best practices for addressing healthcare challenges faced by the 2S LGBTQ+ community. The population of Canadians who openly identify as part of the 2S LGBTQ+ community is on the rise. According to the province, 1 in 5 BC teenagers identify as something other than heterosexual. Yet 2S LGBTQ+ people still experience significant barriers with regards to healthcare access. Healthcare providers should treat each patient as an individual, regardless of sexual or gender identity. In June of 2019, the Standing Committee of Health delivered a report to the House of Commons on the health of 2S LGBTQ+ communities in Canada, including recommendations for best practices moving forward. A key point shared through both reports is the necessity for training and education of healthcare providers regarding the needs of 2S LGBTQ+ patients. In their presentation, Bex provided the board with recommendations for how healthcare professionals can help to remove the barriers to care experienced by 2S LGBTQ+ peoples. And these include familiarizing yourself with 2S LGBTQ community terms, understand how 2S LGBTQ+ identification can impact patient safety and experience, understand how 2S LGBTQ+ stereotypes can impact patient safety, and commit to continuing to learn. To read more about Bex's recommendations, please have a look at their Read Links article or the Pride Read Links article that we shared in July. In the past year, the college has engaged in a number of independent and collaborative efforts to further address and raise awareness of the opioid crisis. This included new OAT training requirements and new delivery requirements for OAT, as well as a number of articles. The new OAT training requirements came into effect on January 1st, 2019, together with a transition period. The OAT Compliance and Management Program, known as OAT Camp, is aimed at reducing stigma and expanding pharmacist knowledge about methadone, Suboxone, and slow-release morphine. It's also intended to improve the experience and engagement of people receiving treatment, and it supports the college's OAT requirements and will eventually replace the college's current methadone maintenance treatment training program. Over 2,400 registrants have already completed the new training program prior to the onset of COVID in March. At tomorrow's board meeting, Professional Practice Policy 66, the amendment to training deadline will be looked at. The transition period will take place up until March 31st, 2021, during which the time the college will require registrants employed in a community pharmacy that provides services related to OAT to complete either the college's existing MMT training program or the new OAT Camp course. We also amended PPP 71, introducing new delivery requirements for OAT, allowing pharmacists to use the professional judgment to deliver the drugs to a patient if they feel it is safe, appropriate, and in the best interest of the patient to do so. Previously, the college allowed pharmacists working in community pharmacies to deliver methadone for maintenance to a patient's home only if the prescribing physician authorized the delivery due to the patient's immobility. These updates to PPP 71 are intended to improve access to OAT for patients whose care may benefit from delivery while ensuring the safety of both the patient and the pharmacist involved. As you're aware, following the onset of COVID-19, the college made temporary amendments to this policy in response to an increased demand for OAT delivery services, including for patients who must self-isolate due to COVID-19. The college also continued its naloxone campaign using social media and digital advertising to help share these resources and build awareness of how to use naloxone to save a life. In February 2020, we introduced amendments to the controlled prescription program forms to create a harmonized form. Prior to these amendments, there were two CPP forms in use, a generic form used for the majority of controlled prescriptions and a methadone form which was used to prescribe methadone for maintenance treatment. The benefits of the new harmonized CPP form include a consistent approach to writing prescriptions for all 1A drugs, increased patient access to OAT therapy, as all physicians will have the form, whereas currently only OAT prescribers would have had the methadone CPP form, and reduced administrative burden associated with ordering and printing 2 pads for 1A drugs. In addition, the new form also reflects the new delivery requirements for OAT, allowing prescribers the option to specify that delivery is not permitted on the form. The new form, once the new forms have been printed by the Ministry of Health. Stay tuned for information on when to expect the new forms to be available. The new Pharmacy Operations and Drug Scheduling Act, or PODSA, bylaws came into effect on April 1st, 2018, and it allowed the college to know the identity of all pharmacy owners, to determine the suitability for pharmacy ownership, and hold them accountable for providing safe and effective care by ensuring that pharmacies are compliant with the legislative requirements for pharmacies in BC. The year-long transition period for all pharmacies to meet these ownership requirements ended with pharmacies whose license expired in May 2019. Now that all pharmacies have transitioned to the new ownership requirements, the subsequent pharmacy renewals will be more streamlined. The transition period was especially important to enable the college to collect initial information from previously unidentified pharmacy owners. The college recognizes that a significant amount of work was required from pharmacies collecting this information as part of the transition period, and appreciates their patience and understanding during the implementation of the new requirements. Pharmacies and pharmacy professionals are expected to have completed phase 2 of the new compounding standards by the end of May 2019. The college has set out a 4-year implementation plan for pharmacies and pharmacy professionals to adopt the new model standards released by NAPRA. This past year, pharmacies and pharmacy professionals began shifting their focus to implementing phase 3 of the new model standards for pharmacy compounding. The deadline for phase 3 was May of 2020 and included standards such as beyond use date, incident management, and waste management, among others. The original implementation deadline for all of the new model standards was May 2021. However, due to the unforeseen impacts of COVID-19, the college's board has approved the one-time only extension of the deadline to implement the sterile model standards to July of 2022. The college's existing bylaws and policies will remain in place until the implementation deadline. The college expects pharmacies and pharmacy professionals to address gaps and update their practice during the implementation period, and to be in full compliance with the model standards once the bylaw amendments come into effect. In February of 2019, we introduced amendments to the Professional Practice Policy 68, broadening its scope and changing its name from cold chain management of biologicals to simply cold chain management. PPP 68 was originally approved in 2011 to address concerns with larger volumes of vaccines being stored at pharmacies as a result of pharmacists' injection authority, but lacked storage standards for vaccines and other biologicals that require refrigeration. Recognizing that there are drugs other than biologicals and vaccines that require refrigeration, it was recommended that PPP 68 be broadened to include any drug requiring cold chain management and revised to better align with current pharmacy standards. Back in November of 2018, new reporting requirements for medical assistance in dying came into effect. As part of the new reporting process, all provincial and federal reportable information began to be collected through new provincial forms for Maine. These new forms include the dispensing record form for a pharmacist who dispenses a substance in connection with the provision of medical assistance in dying, to record details pertaining to the dispensing and return of unused medications, and the BC-made Pharmacy Protocols Guidance document, which is not available for general distribution, but can be accessed by pharmacists who wish to familiarize themselves with the standardized drug protocols through the college's secure e-services site. In April of 2019, minor updates to these forms were made by the Ministry of Health based on input from practitioners and pharmacists. Following these changes, practitioners and pharmacists began using the new forms, which are available for download from the Ministry of Health's website. The college has conducted a number of stakeholder engagements to help us solicit input on college initiatives, policies, and bylaws, including our next strategic plan, the PODSA bylaw modernization, cultural humility and safety, customer satisfaction as part of our ongoing work towards organizational excellence, which included our customer satisfaction survey for 2020, which is currently open. So please share your thoughts with us by November 27th. And to do that, you can visit bcpharmacist.org/customer to learn more and take the survey. Through these stakeholder engagements, the college was able to gather significant input and feedback from patients, pharmacy professionals, pharmacy students, and other health professionals to help us gauge sentiment, identify gaps, and inform our plans. So we thank all those who have provided feedback and shared their thoughts through our various engagements in 2019 and 2020. So with that, I'd like to ask if there's any questions on what we've shared with you today. And if you have any, please share them through the Q&A, which is near the bottom middle of the Zoom application. So we'll just wait for a minute to see if there's any questions or comments that you wish to make. Okay, I'm not seeing any questions, so I think I'll hand it back to Chair Antler to adjourn the meeting.
Thank you, Registrar Nakagawa. I do think that we've seen a question that has come in, so I'm going to pose it to you, which I believe says, why the focus on Black Lives Matter as opposed to and I'm not sure, there's sometimes, but I assume it's all lives matter to take into account other minorities.
Black Lives Matter is hugely important, and Black people throughout, I think across the world, most prominently within North America, have experienced incredible systemic racism and to the degree far greater than any others have. They fear for their lives if they're pulled over by the police. They justifiably have had very different experiences than any other group. And I do not subscribe to the belief minimizing it through the statement that all lives matter is appropriate. Black lives matter, and we need to make a statement that focuses on their exceptional trauma and racism and discrimination. It is not acceptable, and I believe that they deserve to be identified specifically with the moniker Black Lives Matter.
Thank you. Seeing no other questions coming in, I'm going to thank everyone for attending and participating in the college's 129th annual general meeting today. I'd also like to once again thank the board for all your contributions over certainly the fiscal year that we were reporting on, but certainly this past COVID year, it has truly been exceptional, and it's been my honor and privilege to be chairing the board during this time. So having completed the agenda, the annual general meeting of the College of Pharmacists of BC now stands adjourned. Thank you all.